That feeling hits you again. Just pure exhaustion, right down to your bones, even though you haven't really done much today. Maybe you just walked out to get the mail, or tidied up the kitchen a little, but suddenly, you feel like you need a long nap. And it's not the first time, is it? It's easy to just sigh and think, well, I guess this is just what getting older feels like. So many people feel that way. It's completely understandable. We see changes in our energy, maybe aches and pains creep in. And it just seems logical to chalk up things like persistent tiredness to the number of candles on our last birthday cake. But what if it's something more? That's what I'd love for us to chat about today, just us, friends talking together. We're going to explore some of those sneaky warning signs of heart trouble that often get missed, especially as we get older. Because let's be honest, heart disease is incredibly common. It affects a huge number of us over 60, nearly 3/4, and even more as we reach our 80s. Yet, the signs aren't always the dramatic chest-clutching moment we see in movies. Sometimes, they're much quieter, easier to explain away, and knowing what to look for, really listening to our bodies, can make such a difference. It's about catching things early, when treatments might be simpler and less invasive. And most importantly, it's about protecting our health so we can keep doing the things we love, stay independent, and truly enjoy these years. Over the next little while together, we'll explore some simple ways to tune into our bodies, looking at things like changes in energy, breathing patterns, maybe some swelling you've noticed, dizziness, and even pain that shows up in unexpected places. Think of it as becoming a better detective for your own well-being. So, let's start with that feeling we just talked about, that deep, unexplained fatigue and weakness. This isn't just feeling a bit sleepy after a busy day or a poor night's sleep. This is a persistent tiredness that really gets in the way of your normal routine. Maybe you used to enjoy gardening for an hour, but now even 15 minutes feels like a marathon. Or perhaps you find yourself needing to sit down and rest halfway through grocery shopping, something you never had to do before. It's the kind of fatigue that doesn't seem to get better, even after you've had a good night's rest or taken it easy for a day or two. It just lingers, week after week, maybe even for months. You're certainly not alone if you've experienced this and just thought, oh, I must be overdoing it. Or maybe blamed it on a medication side effect or another health condition you might have. It's so easy to rationalize. But here's why we need to pay closer attention. When your heart isn't pumping blood as efficiently as it should, your body's tissues and muscles aren't getting the oxygen and nutrients they need. This can lead directly to that profound sense of fatigue. It's actually one of the most common symptoms reported by people living with heart failure. Studies show up to 70% of them feel significantly tired. And interestingly, it's often a key symptom women report experiencing in the weeks or even months leading up to a heart attack. Not necessarily chest pain, but overwhelming, unusual fatigue. So, if you notice a level of tiredness that feels different, that stops you from doing your usual activities, and it doesn't seem to have an obvious cause or doesn't improve with rest, it's definitely worth mentioning to your doctor. It might be nothing serious, but it could also be your body trying to tell you something important about your heart. A simple thing you could try is just keeping a little note for a week or two. Maybe jot down your energy level on a scale of 1 to 5 each afternoon and what you did that day. Sometimes seeing a pattern on paper makes it clearer that something has really shifted, and it gives you something specific to discuss with your healthcare provider. Does that sound like something you might have noticed creeping up? Building on that idea of subtle changes, let's talk about breathing. We all get a little winded sometimes. maybe climbing a steep flight of stairs or rushing to catch a bus. That's normal. But what we're talking about here are more subtle shifts in your breathing, especially when you aren't doing strenuous activity. Maybe you find yourself getting short of breath just walking from the living room to the kitchen, or even while you're sitting down talking on the phone. Or perhaps you've noticed you need to prop yourself up with an extra pillow or two at night to breathe comfortably. Lying flat suddenly feels difficult. Waking up suddenly in the middle of the night, gasping for air, is another really important sign. Again, it's so easy to brush this off. I'm just getting older, or I really need to get back in shape. Or maybe you think it's related to allergies or a touch of asthma, and sometimes those are indeed the reasons. But shortness of breath, especially when it happens during rest or with very minimal exertion, can be a sign that your heart isn't keeping up. It could indicate conditions like coronary artery disease, where narrowed arteries restrict blood flow, or heart failure, where the heart muscle struggles to pump effectively. When the heart can't pump blood forward efficiently, fluid can back up into the lungs, making it harder to breathe. This fluid buildup is also why some people might develop a persistent cough or wheezing, sometimes even producing mucus that looks pinkish or has streaks of blood. That's a definite red flag. Another related clue can be needing to get up to urinate frequently during the night. This happens because when you lie down, some of the fluid that might have accumulated in your legs during the day gets reabsorbed into your bloodstream, and your kidneys work to get rid of that extra fluid. So, if you're suddenly making multiple trips to the bathroom overnight and also experiencing breathlessness, it's worth considering if they might be linked to your heart. Pay attention to when you feel breathless. Is it only with heavy effort, or does it happen during simple daily tasks? Does it come on suddenly? Does lying down make it worse? Noticing these details can help you and your doctor figure out what might be going on, and this relates closely to another sign that often gets overlooked: swelling, particularly in your legs, ankles, and feet. We call this edema. You might notice that your socks leave deep indentations around your ankles at the end of the day, or maybe your shoes feel unusually tight, especially as the day wears on. Sometimes the swelling is quite noticeable, making your feet and ankles look puffy. It's incredibly common to attribute this to other things. Maybe you think, "Oh, I must have stood on my feet too long today," or "I probably had too much salt at dinner last night," or perhaps you know that one of your medications lists swelling as a possible side effect. Many people find that putting their feet up for a while helps the swelling go down temporarily. While all those explanations can certainly be true sometimes, persistent or worsening swelling in the lower extremities can also be a sign that your heart isn't pumping blood effectively. Think of it like a plumbing system. If the pump isn't strong enough to keep things moving forward, fluid can start to back up in the system. In the case of the heart, this backup can cause fluid to leak out of the small blood vessels, capillaries, into the surrounding tissues. And because of gravity, it often collects first in the lowest parts of the body, your feet, ankles, and legs. This is a common indicator of heart failure. What makes it particularly concerning is if the swelling seems to get progressively worse throughout the day, or if it doesn't completely resolve overnight. Another telltale sign related to this fluid retention is sudden, unexplained weight gain. If you find you've gained 5 pounds or more in just a few days, it's unlikely to be actual body mass. It's much more likely to be retained fluid, and that warrants a call to your doctor. In some cases, the fluid buildup isn't just limited to the legs. It can also cause swelling in the abdomen, making your stomach feel bloated or full. A simple way to check for this kind of swelling called pitting edema, is to gently press your thumb into the swollen area for a few seconds. If it leaves a noticeable indentation that slowly fills back in, that's a sign of fluid buildup. Keeping an eye on your ankles and feet daily, maybe when you put on or take off your socks, and noticing if shoes suddenly feel tight can be simple ways to monitor for this. And if you do notice swelling, stepping on the scale each morning can help track any rapid weight changes related to fluid. It's another piece of the puzzle that's important not to ignore. Another important aspect to consider is changes in your heart rhythm, or maybe feeling dizzy or lightheaded. As we age, it's true that minor heart rhythm irregularities, like occasional skipped beats or palpitations, can become more common. And feeling a little dizzy, if you stand up too quickly, happens to many of us from time to time. So, it's easy to think, oh, it's just stress, or maybe I had too much coffee, or I just got up too fast. These feelings can be fleeting and seem minor. However, more significant or persistent changes in your heart rhythm can signal serious underlying conditions, like atrial fibrillation, often called AFib, which is an irregular and often rapid heart rate that becomes much more common in older adults. AFib significantly increases the risk of stroke, so recognizing it is crucial. What should raise a flag? Well, pay attention to sensations like your heart feeling like it's racing, fluttering rapidly, pounding hard in your chest, or frequently skipping beats. You might also notice that your pulse feels unusually fast, or sometimes surprisingly slow. These rhythm changes can sometimes lead to symptoms like dizziness or lightheadedness, especially when you change positions, like going from sitting to standing. In more serious cases, it might even cause fainting or feeling like you are about to faint, near fainting. It's not just about having one skipped beat or feeling lightheaded once in a blue moon. What's concerning is when these sensations happen repeatedly, last for more than just a few seconds, or feel particularly strong or uncomfortable. Learning how to take your own pulse is a really useful skill. Just place 2 fingers gently on the inside of your wrist or on the side of your neck. Count the beats for 30 seconds and multiply by 2. Knowing your typical resting heart rate can help you notice if it suddenly seems much faster, slower, or irregular. Even if these episodes seem minor or infrequent, mentioning them to your doctor is important. They might want to do a simple EKG, electrocardiogram, right there in the office, or perhaps have you wear a monitor for a day or longer to capture what's happening with your heart rhythm during your normal activities. Don't downplay these feelings. They could be important clues. Of course, alongside these other signs, there's also the matter of pain, but perhaps not in the way you typically think of heart-related pain. We've all seen the dramatic movie scenes where someone clutches their chest in agony during a heart attack. And while severe chest pain or pressure is absolutely a critical warning sign that needs immediate emergency attention, seniors, and especially women, often experience heart problems, including heart attacks, with more subtle or atypical pain patterns. This is a really important point because if you're only looking for that classic crushing chest pain, you might miss other crucial signals. Think about discomfort or pain that shows up in places other than the center of your chest. It could be an ache or pressure in your jaw, maybe radiating up into your neck. It might feel like discomfort or heaviness in one or both arms, often the left, but not always, or in your shoulders. Sometimes it presents as pain in the upper back, between the shoulder blades, or even as discomfort in the upper abdomen, which can easily be mistaken for indigestion or heartburn. It's completely understandable why these symptoms get missed. Who immediately thinks heart when their jaw aches or they feel like they have indigestion? The character of the pain might also be different. Instead of a sharp, stabbing sensation, it might feel more like pressure, tightness, squeezing, or fullness. For instance, a friend of mine kept complaining about a nagging ache in her left shoulder for weeks. She thought she'd pulled a muscle gardening. It wasn't until she also started feeling unusually breathless doing simple chores that she finally went to the doctor and discovered it was related to her heart. Another key feature is that this discomfort might come and go, or it might worsen with physical exertion, like walking up a hill or carrying groceries, and then ease up when you rest. That pattern of symptoms worsening with activity and improving with rest is a significant clue that it could be related to your heart not getting enough blood flow when demand increases, a condition called angina. So, the takeaway here is not to ignore persistent or recurring discomfort in these atypical locations: jaw, neck, shoulders, arms, back, upper abdomen, especially if it seems linked to physical activity or comes along with other symptoms like shortness of breath, fatigue, or nausea. It's always better to get it checked out. Does that make sense? It widens the picture of what we need to pay attention to, doesn't it? And really, that's the common thread through everything we've chatted about today: paying attention, listening to your body, and not automatically dismissing new or persistent symptoms as just part of getting older. It's true, our bodies change as we age, but significant changes in your energy levels, breathing, swelling, heart rhythm, or experiencing unusual pain patterns deserve a conversation with your doctor. We know that catching heart disease early makes such a huge difference. It often means treatments can be less invasive, maybe just medication and lifestyle adjustments rather than major procedures. It helps prevent really serious complications down the road, like a major heart attack, stroke, or developing severe heart failure. And fundamentally, it's about maintaining your quality of life, your energy, your ability to stay active and independent, and enjoy time with family and friends. It's also worth acknowledging that sometimes it is tricky to spot these signs. Symptoms can indeed mimic normal aging. And let's be honest, sometimes we might downplay symptoms because we don't want to worry our family. Or perhaps we just don't want to face the possibility that something might be wrong. Many of us are also managing other health conditions, like arthritis or diabetes, and the symptoms can overlap, making it harder to pinpoint the cause. If you're less physically active than you used to be, you might not even put enough demand on your heart to trigger noticeable symptoms like breathlessness or atypical pain until the condition is more advanced. All these factors can make detection challenging, which is why being mindful and proactive is so important. So, when should you definitely reach out to your doctor? Make that call if you experience any new or persistent symptoms that are affecting your daily activities. That unexplained fatigue that just won't quit, the breathlessness doing simple things, the new or worsening swelling, those funny heart flutters, or that nagging discomfort we talked about. Don't wait for your annual checkup if something feels off now. And please, remember this: if you experience severe symptoms like intense chest pain or pressure, sudden severe shortness of breath, fainting, or symptoms like chest discomfort, accompanied by nausea, vomiting, cold sweats, or extreme weakness, that is an emergency. Don't try to drive yourself. Call 911 immediately. Time is absolutely critical in those situations. So, as we've been chatting about, these seemingly small signs, the extra tiredness, the slight breathlessness, the puffy ankles, the flutter in your chest, the ache in your shoulder, they can be your body's early warning system. Tuning into them, taking them seriously, and talking openly with your doctor really empowers you to take charge of your heart health. It's not about being fearful. It's about being informed and proactive. Remember, be kind to yourself through this process. Nobody expects you to become a medical expert overnight. It's simply about developing a greater awareness of your own body and trusting your instincts when something doesn't feel quite right. Every little step you take towards understanding your health and communicating with your healthcare providers is a positive step. You're investing in your own well-being, and that's incredibly valuable. I hope this conversation has been helpful. Maybe shed some light on things you've experienced or wondered about. I'd love to hear your thoughts, or perhaps any tips you have for staying tuned into your body. Please feel free to share in the comments below. It's always wonderful when we can learn from each other's experiences and build a supportive community right here. If you found our chat helpful today, please do give the video a like. It helps others find this information too. And if you'd like more conversations like this, focused on living well and staying healthy as we navigate our 60s, 70s, 80s, and beyond, please consider subscribing to the channel. Take good care, be well, and here's to making every day a little brighter.